So in 2011, Network 180 and Spectrum Health came together to really build the first partnership and a bridge to developing an idea about how to deal with patients who the normal system of care didn't work for. And so in 2005, in 2011, we opened the Center for Integrative Medicine. And what that did is it allowed for both not only a co-location of behavioral health and medical health, but an integration of behavioral health and medical health. Since that point in time, we've learned a lot. We've seen over 350 patients. We've really defined the disease entities in which we have to understand before we can actually begin to change the behaviors and the outcomes of those. And we've now come up with a pretty good understanding of what this subset of patients really does mean to both the system as well as to the patient themselves. And so now that we've developed an understanding of who they are, we've been able to develop really good treatments that are allowing us to work way beyond the standard of care and allowing us now to be very creative with the way that we pay for it and to be able to track outcomes and to be able to track performance of whether or not the patient is truly becoming more functional than they were before we saw them. So I'm looking forward to 2014 because I really feel that we're going to be able to move forward at a pretty rapid pace now that we've learned all of these things. And these things include, what are the biggest risk factors for someone being in the emergency department more than 10 times in a year? What are the risk factors for someone not having a stable substance use disorder treatment pathway? And now that we know that housing, transportation, communication, as well as just the general cultural background of a patient is really what makes up the chances of us getting them better, more so than what prescription is written and more so than what words are said. It enables us to build these systems moving forward so that we can then be ready to expand on April 1st with Medicaid expansion. And as we have more people come into the fold with the capability to pay for services, to be able to deliver an efficient and effective service plan for these patients. An effective and efficient service plan sounds quite sterile when you talk to a patient. And so what it really means for the patient is that their lives are going to get better. That ultimately we will help to stabilize their housing. We will help to stabilize their transportation. We will identify what it is that they feel are the biggest issues that need to be dealt with and work with them to make those better. And that's where I believe that this connection between Network 180 and Spectrum Health and Network 180 and many other entities within Grand Rapids and Kent County and even the Lakeshore has now enabled us to develop systems of care that are not reliant on a certain person delivering that care, but instead rely on the development of processes that enable patients to make better decisions about their health and overall have them have a better understanding about their health care. And so by combining all of these things in 2014, I really do believe that we're going to be able to significantly bend the cost curve in dealing with these patients, but more importantly, give these patients function back, give them the ability to go to work, give them the ability to have their families, and give them the ability to function within society so that they feel like they belong rather than being on the outside.